public health is a rare lamp that can push back the dark shadows of vulnerability, of misfortune, and of poverty in our ever increasingly complex world. In the Balkans, others like to speak about southeastern Europe, the wick of public health must be turned up and its bright flame lengthened. Political support can provide oil to fuel the lamp. Health diplomacy and the principles of human security can be useful tools to public health. When the political will falters or is subverted, health damage may result. The World Health Organization and the Council of Europe called attention to the growth of population vulnerability and the declining health status in the Balkans. Together, and within the context of the Stability Pact, they targeted social cohesion. One outcome was the Dubrovnik Pledge, a political agreement that made a commitment to regional health development by meeting the health needs of vulnerable population. Country projects relating, for example, to infectious diseases, Albania, nutrition, Serbia, mental health, Bosnia-Herzegovina, and emergency medical services, FIOROM, were additional outcomes. Another outcome was the Network for Public Health for Southeastern Europe. This network is an impressive list of publications covering a wide range of subject materials and books for students, and has addressed the development of schools of public health and the need for a health curriculum for peace. Most recently, it launched this journal, the Southeastern European Journal of Public Health. The value system of public health is succinctly and differently expressed in the Skopje Declaration for Peace, Public Health and Human Rights, another outcome of the said network. It was later adopted by the World Federation of Public Health Associations. In words and spirit of the Skopje Declaration, our actions must build a better Balkan world closer to the human heart's desire. Public health emphasizes a cybernetic or systems principle. Its improvement must be addressed using strategies and action plans that are multidimensional, interdisciplinary, and strongly backed by adequate human resources, by considerable ingenuity, and with policy instruments commensurate to the same level of complexity of the problem space. Training for competence improvement of public health professionals and the strengthening of schools of public health is a regional priority embedded in the same principle. Throughout the region, the role of knowledge for development is being vigorously debated. The emergence of a Balkan research culture will depend upon abundant light and enlightenment. Progress in public health will depend on the existence of more autonomous institutions for research and education, mechanisms for accreditation and evaluation, which can include scientific journals such as the Journal for Southeastern Europe, as well as competence to innovate and implement and direct education towards human development. A place in the new world will depend on science, truth, and reconciliation, as well as a rightful place for the Balkans in Europe. Development must be inseparable from socio-economic reform, target better wages, housing, living and working conditions, and promote health security, which equates to freedom from want and freedom from fear. By use of metaphor, we can say that the regional intellectual capacity of public health is expressed and in the launch of this journal, Southeastern Europe Journal of Public Health, which is much akin to a line of new Albanian castles, which can stem the tide of greed and corruption and pave a way for regional health development by building on what went before. The journal is a new vehicle for discussion and debate. It can help institutional renewal of public health, give a boost to investment in training for competence, promote policy implementation, and the design of multidimensional action plans to ensure human safety and health protection. It must be prepared to break down academic barriers and build the public health community of the Balkans. It should be positively viewed and strongly supported as a channel for change promotion. Asclepius and his disciple Hippocrates, father of Western medicine, acted as change agents when they proclaimed, "We have an opinion. Let's discuss it. If the evidence warrants, let's change it." Today, we have evidence-based medicine, health technology assessment, and frequently modified or changed clinical guidelines. Half of what is true today will be questioned in the next few years. Can we predict which half? Do we have such good discriminators? A competent journal can help in this direction. Public health training has become less fragmented and now presents a more uniform profile. This process was aided by the establishment in the Balkans in Zagreb in 1968 of the Association of Schools of Public Health in the European region, as a contact point, then as a hub for informational exchanges between related schools and institutions. ASFA, as it is known, is a network of expertise whose functional links integrate training, science, and public health policy and promote cooperation in Europe and between regions and continents. Over the past 3 decades, the Balkan region has courted disaster one after the other. It has suffered from economic sanctions, from political upheavals, from radioactive fallout, from armed conflict, and from wars, Bosnia and Kosovo, from socioeconomic disaster and ecological calamity, as well as from earthquakes, floods, and most recently, a creeping health disaster in Greece of uncertain dynamics, a result of austerity measures imposed by the government in response to the global financial crisis. A decade or so ago, I suggested that within an enlarging and safer Europe, the language of health is key to a better future. Without adequate socioeconomic management, population vulnerability can trigger a creeping social disaster. In the Balkans, where cultures, religions, and national languages come together, public health can be a common denominator for development. I've also argued that the region's best future is in its organization without borders and within a single European space. The outcome of any complex activity is hard, if not impossible, to predict. All we can hope for is that ingenuity and leadership will prevail, that Balkan governments will provide public health governance within a competent infrastructure capable of monitoring success and failure, and with effective corrective mechanisms for the righting of wrongs. In the Balkans, let's now hope for frequent, significant ups with fewer and smaller downs. Development of schools of public health, journals, such as the new journal in the Balkans, and the recent return of the presidency of ASFA to the region, albeit temporarily, where it was born, are some significant ups. Let's hope that a new moment for regional public health has come. If the Balkans makes it in public health, it will make it in Europe. Failing to manage the health of the Balkan region can have serious consequences for Europe. Europe without its cradle will not sleep well. Albanian Castles in Defense of Public Health, in Defense of Balkan Public Health, is a title paying tribute to extensive activities between Greece and Albania, conducted by the Athens School of Public Health and sponsored by the Greek Ministry of Health. It gave the speaker opportunities to mentor students, Albanian students that is, visit castles and archaeological sites, interact with many directors of the Institute of Public Health and several NGOs, heads of hospitals, university staff, members of parliament, and of course with many health ministers. Two who the speaker interacted with in both Prizren in Kosovo and Belgrade in Serbia, and one who was honored by the school. Projects were conducted throughout Albania, and one was funded through the European Union FAR. The Athens School of Public Health was initiated by Eleftherios Venizelos in 1929. It was one of two schools that Venizelos inaugurated. Venizelos initiated a short-lived revolution in public health with the help of the international community, the League of Nations, and the Rockefeller Foundation. The school became a founding member of ASFA, and it conducted the first Balkan Public Health Forum when the creation of schools of public health in Albania and Serbia were also discussed in 1992.